Strange though it might seem, the COVID lockdown didn't just create a boom for online shopping and subscription television, but also, oddly, for fertility clinics, as Steph Nash reports.
It was the best of times, it was the worst of times. COVID, while troubling, brought many of us closer together. Plagued by isolation and uncertainty, we took stock and put family first. It even came to expanding families. Kathleen Waite from the fertility services clinic Genea has witnessed more customers because of the pandemic.
I think the pandemic has given people time to reflect, to pause and reflect on what's important to them, and family has definitely come up. So for people who might have had starting a family, definitely on their horizon, they've really made a conscious decision to make that a priority.
For some couples, having children requires extra help. IVF.
So we were a little bit older when we met, and my husband had a 10-year-old son at the time, and so we knew that we just wanted to get straight into having babies. And on paper, we should have been able to have children, but it just wasn't happening for us. So we went and spoke to our GP, and she referred us over to Genea.
The result for Debbie and her husband is baby Ellie, but they are not alone. Since COVID, specialised healthcare services, including IVF, have experienced a big increase in demand, and others are seeing it too.
Yeah, health as a sector is growing quite quickly now, so there's a lot of forces at play, ageing population, but also our demand for a better life. So there is a lot more specialisation, and that's not just in health but many industries as well. You're seeing kind of a lot more proliferation, a lot more verticals appear.
But there is also breakthrough technology behind this expansion. For Genea, one area of growth is the freezing and storing of a woman's eggs or embryos until the time is right to have a child. The process is called vitrifying, and it's done using a special freezing system called Garvey, a world-first automated technology developed by Genea.
Women have been telling us that obviously through the pandemic it's been much harder to actually get out there and meet people. So normal social activity has been, somewhat curtailed during that time. So women are really looking for ways in which they can control their fertility and find options to help them in the future.
For Genea, technology like the Garvey freezing pod and Jerry, the incubator system for IVF, is central to the business model. It's crucial for achieving a high success rate for families, and from a business point of view, that attracts new customers.
That innovation is really part of our DNA and really what drives us as a company. The incubator that we've designed means that it's what keeps the embryos warm and exactly at the right conditions while they grow in our laboratories. The incubator that we've designed has a camera attached, which means that our scientists can view the embryos as they're growing. We can share the images that we're seeing, that our scientists are seeing in the lab. We can share those with our patients, and it's really improved the patient experience. It's really helped them feel connected in a process that sometimes, they can feel it's really out of control.
Fertility treatment requires an element of sensitivity. For patients, it can be physically invasive and emotionally distressing. For Genea, investing in quality care and services is important.
We knew that they had really great success rates. They seem to be leading the way with some of the technology that they use as well. And what was most important for us was that they actually tailor your treatment plan to what's going on for you and how your body's responding. It wasn't just a sort of cookie cutter approach for everyone. So that was really important for us. Yeah, it was very hard. It was physically and emotionally draining, but we were really lucky. We've got 2 beautiful babies out of it.
With demand growing, Genea is looking for new avenues to expand, including overseas markets. Shane Howell says that's a natural step for growing businesses, but it's not without its challenges.
People are having different types of conversation, whether that's a larger footprint, they need more equipment, but also with a lower interest rate cycle, a lot of people who are leasing premises want to buy now. It is a real opportunity for them to set up for the long term. We have seen a lot of questions coming into our bankers, do I rent or do I buy? what are the constructs around that, and how will that set me up for success in the long term? And we've seen a lot of that, which is it's playing through in property prices.
But for now, much of the focus is on local expansion to improve access to services for customers across the states.
We have plans to open a clinic in Queensland and open a second clinic in Melbourne, and that's really come as a result of patient demand. It's really wonderful to be able to partner with people like Westpac, who share our vision for being able to expand our services and bring our care, our science and our success rates to more patients throughout Australia.